Hello, and thank you for joining us. This is Health Matters on Channels Television. I am Mary Alale Yusuf. All over the world, there are more than 260 million confirmed cases of COVID-19. By Friday, November the 26th, the death toll was over 5.1 million. In Nigeria, there were more than 213,000 confirmed cases of COVID-19, but more than 207,000 people have recovered. Globally, over 7.5 billion COVID-19 vaccines have been administered, while in Nigeria, over 6.3 million have got a first shot, and more than 3.5 million are fully vaccinated. Now on to the topic of the day. Noma is a disease which affects children, usually between the ages of 2 and 6 years. Noma, a Greek word which means devour, literally destroys and eats up the mouth and face of affected people. It starts as a lesion or sore of the gum, progresses rapidly, and if not treated, becomes life-threatening in a matter of days. Noma is fatal in 90% of cases, but knowing the prevalence is a bit difficult since most cases go undocumented. But the World Health Organization estimates there are 140,000 new cases every year. Noma is preventable and treatable. My guest joining us in our Abuja studio is the Deputy Director, Médecins Sans Frontières, Dr. Bukola Oluyide. You're welcome to the show.
Thank you so much. Happy to be here.
Let's know what causes Noma. Is there a particular causative factor, agent, bacterium, or something like that?
Actually, for Noma, the etiology is unknown. What we know is there are risk factors to Noma. We have things that depress the immune system, like a child who has malnutrition, a child who has measles or malaria, and being in that situation where they are immunosuppressed or immunocompromised, they now have the possibility of developing Noma. Other risk factors, people living in deplorable conditions, in places where the oral hygiene is not optimal, are those risk factors that you could see that they develop Noma. Noma starts as a lesion in the mouth, just a sore. But when combined with other factors like the ones I've mentioned, even HIV could now make it progress from just a sore to something that they lose part of their face, and then come down with debilitating condition or even death.
Can you describe a bit more the progression of this Noma? What exactly does it eat up? Does it eat up bone, teeth, cartilage?
Yes, so when it starts in the gum, and then it progresses from that point up till eating up the flesh. So it could eat up the lips, the cheek. The cheek is one of those places that is really common. It could go all the way to the nose and sometimes affects the eyes. Sometimes it also goes down into the bone and also disrupts the joints, the mouth joints. And then if they survive, for those that it affects the joints, it's very difficult for them to move their mouth, to open their mouth, difficult for them to be able to eat. It also can progress to, cause what we call sepsis, and that's why it's life-threatening. Apart from it being in the mouth, the infection could spread to the body, cause sepsis, and one of the reasons they get to die. Over to
Okay, you have a Noma hospital in Sokoto. Is this disease geographically restricted? Why? Is it just in the north? Even though I'm quite sure I have seen one case, I was really confused. The person's face was all twisted and walking on the street, and I was wondering, what kind of face is this? But is it geographically restricted?
No, I won't say it's geographically restricted. The other risk factor we noticed is also immunization. And we know with the immunization statistics in Nigeria, is lower in the north than in the south. Yeah, and then we know that in terms of those who have it a little bit harder in terms of survival, it's more in the north. So you see more cases happening in the north than in the south. But it could happen anywhere. Because if the risk factors are there, it will happen that they can develop Noma.
Well, I don't know if I'm mistaken, but I did check, and I didn't even find this disease in the list of neglected tropical diseases. I think for 140,000 a year, it's significant enough, and for the damage it causes. Is it among the NTDs?
No, not at the moment. So that's one of the things we are trying to advocate for. We've been having discussions on it, and with countries as well that report cases. We feel that Noma is one disease that ticks all the boxes to be listed as an NTD. It is found in tropical and subtropical countries, but also where those risk factors are, you could find it. So with other NTDs, it also maps out the same way across the globe. In terms of the control measures for Noma, it also links up with the NTDs as well. You know, ensuring that there is more surveillance in the community about Noma, more surveillance in the hospital about Noma, getting more data about Noma. As you said, Noma is neglected, that research about Noma is really limited. It also ticks those boxes when you link it up with the Sustainable Development Goals, the SDGs, when you talk about eradicating hunger or poverty or ensuring better health care. Once you're able to tick all those boxes, you are sure that Noma is something that will not exist anymore. So that's why we advocate that more attention globally should be put to Noma, as Noma is identified as that last step in which you haven't been able to, control poverty, you've not been able to ensure there is food, and you've not been able to ensure there is a proper health care. Then you have people that have Noma. And we should get to that point where once we ensure that all of these are gone, then we know that we will not be seeing Noma cases. We will not be having Noma as one of those things we see in the hospital.
At least...
The other thing we talk about...
Just a moment. At least the WHO has recognized Noma. 1994, they said it's a public health problem. But I'm wondering, why isn't it more recognized, more known by people?
So yes, WHO has recognized it as a public health problem, but it is not known by people because it is really hidden. As you said, when you see the face, it's disfigured. So a lot of people are stigmatized, and they hide from the general population when they have Noma. And it is just assumed, even in the medical world, that Noma has gone away. When you talk, especially from some of the professors in the South, it's more like, yeah, we used to see Noma, but we don't see it anymore. But we're trying to get it back into the curriculum, into trainings for the healthcare professionals to be able to recognize even the early stages of Noma so that they can be able to treat it before it progresses to that disfigurement stage. So it's almost like nobody necessarily knows any more about Noma and think it's gone. But actually, Noma is coming back, especially with the fact that we see poverty becoming worse than before.
What should we see as a red flag so that we can act quickly? Because from my understanding, it takes about 2 weeks for it to completely damage the face once it has set in. 2 weeks is a very short time. So how does somebody see and act fast?
Exactly. The first thing is for us at home and for healthcare professionals in the hospitals. when we see children present for any type of condition, it's very important that we check the mouth. The first stage of Noma is that they have the red gums or the swelling or a very fetid mouth odor. So just checking and seeing that the gums are healthy is the first step. And then the next step is advising on some oral hygiene, some oral, cleanup. If it's with salt and warm water.
When you talk about oral hygiene, must they have the fluoride-containing toothpaste? Or, these are poor people. Can they use a chewing stick?
Exactly. We also promote, the locally available remedies that there are. So they could use a chewing stick, but it's important that they are actively, routinely cleaning up their mouth. With the chewing stick, something as simple as warm water and salt, where they ensure that they are using that to get out the oral bacteria that is there. We also say Noma is opportunistic, so it means that we do have bacteria. All of us do have bacteria in our mouth. But then, if we are not able to regularly rinse it out and we have something extra like measles or malnutrition or malaria, then it now feeds on the oral tissues in the mouth and now breaks down those tissues and all those tissue is lost. So just even ensuring that a simple cleaning of the mouth is done on a regular basis would really help to ensure that Noma doesn't progress to the disfigurement stages.
Okay, so we've been using drawings to depict what Noma looks like. The pictures are way too horrible. We don't want to affect the sensibilities of our viewers, but it really, really looks terrible. So here's my question. Antibiotics are things that people use, even abuse, on a normal daily basis. Is it not antibiotics that you use to clear out a Noma infection? So that if somebody uses antibiotics, for example, because there's a fever or something, it should inadvertently also take care of any other thing that was trying to rear its head, like Noma.
Exactly. You would assume that, but what happens is those people that develop Noma don't even have that opportunity to have used antibiotics. So it's still more with access to healthcare. Are they able to get to a health practitioner and get antibiotics for, like we said, malaria is there and then they have measles. Because it's affecting the poorest of the poor, they're not even able to have that access to antibiotics. But for Noma, once it gets to that stage of needing antibiotics, the most simplest antibiotics are able to clear it out. But then those that need it might not be able to get it because they are not able to afford it or they are not able to even have access to health care.
You spoke of certain risk factors, malnutrition. Okay, we understand that some people are very poor. You also mentioned vaccines, taking routine vaccines. We assumed that those routine vaccines are free and they are everywhere, but it appears not to be so. Is it that they are not there, they are not free, or people are refusing to take them?
I would say it's a combination of everything, but in the end is that the hard-to-reach areas are those places where you would even get them to have it. So we know that there is the oral polio campaign that has gone to lots of places to ensure that we are, declared polio-free. But we also know that a lot of things have hindered that as well. We know insecurity. We know that COVID as well has reduced that access to health care. And then we know that there are those rumors that go around concerning vaccines. So I'll say it's a combination of everything. that I've mentioned that hinders the children from getting the measles vaccine or all the others that are important for them to be able to fight diseases. And
Okay.
what we do in terms of awareness is also to talk about the importance of vaccination, and when they come to the hospital, to ensure that they have the catch-up vaccination as well for them and then for their siblings.
All right, we're going to take a short break. When we come back, we'll continue the discussion. Please stay with us as we go on a short break. Welcome back. We're talking about Noma, a little-known disease, very devastating but treatable and preventable. To ask any questions on Noma, do call 0805-468-3415. It should be showing on your screen, and we shall continue the discussion. So, Doctor, let me ask you, there are several risk factors we know. But can any one of these risk factors on their own be the cause for Noma happening, or must there be an interplay of all these things? For example, if a child feeds well, can we say there won't be any of this?
I would say it's an interplay of the risk factors. So a child feeds well and ensures, he has to ensure there is also the oral health hygiene going on a regular basis. But we also have to ensure that the vaccines are up to date, because then we can prevent those diseases like measles from happening.
Okay, so having said that, that it's an interplay of all these things, my next question would be, what would it take to eradicate Noma in Nigeria? Because it looks like something that can easily be done away with.
Yeah, I would say the most important thing is poverty, to ensure that people have something in terms of social support, in terms of being on a level where they're able to take care of their children. And there are some programs where they look at the first 1,000 days of a child. If we could also look at taking care of children for those first, 5 years of their life, and then we are sure that they are able to grow up to be adults without any disfigurement or any morbidities that have happened to them. That would be I would say, the most important thing. With all the control measures that we have in place for other entities, and when we talk about the SDGs as well, if we're able to achieve that, then we would have Noma out. It will be, I see Noma as that indicator to say that we have achieved something in terms of poverty, in terms of access to healthcare, in terms of ensuring vaccinations are higher than what they are, especially in the northern states.
Okay, let's quickly take this call from Ada. She's in Jos. Hello, Ada.
Hello, yes, Ada, calling from Jos. Thank you
are
very
welcome
much for this program, Mary. Honestly speaking, I must tell you the truth. I have never heard of Noma. I must tell you that I'm so, I don't know how to look at the whole thing. And then the doctor there, thank you very much. But what I don't understand is that since the disease is there and it's not really common, people don't get to know about it. Many people suffer from it and they don't even know they are suffering from it. And she has talked about vaccination and the rest of it. So what are we waiting for? It's a disease that is not found among the elite. You can see what is happening about COVID. They don't want to civil servants to take the vaccination and all that. So why are they neglecting this one? And I want to find out, I didn't follow from the beginning. So I don't know whether she touched on it. Can it only happen to children, or is it anybody who malnourished can get the Noma? Thank you very much. God bless you.
Thank you so much. Thank you so much, Ada. There you go. She's saying, what are we waiting for? It looks like something that we can just handle. And then also, does it happen to adults?
Yes, Noma can happen to adults, although it's more common in children. For an adult who might be immunosuppressed as well, so HIV, cancer has also been reported in people who have cancer, and in any part of the world they can develop Noma.
Oh, that is scary. But, you know, looking at the ages, 2 to 6, it looks as if breastfeeding might be a major cause for it not happening earlier than 2. So why not advise mothers about nutrition once the child is weaned?
Yes, very important to ensure breastfeeding is happening, but also to ensure that they are able to progress to complementary feeds as well. We don't see it as common in the younger age group as 2 to 6. We think breastfeeding is protective. There was a study done that showed that for those who weaned earlier, the likelihood was higher. So we would encourage more breastfeeding as one of those ways of, but also to ensure that they progress to high protein diets so that their immune system are boosted, especially when the maternal antibodies are reducing from the child.
I looked at some of the pictures of people who had been treated for Noma, and they had these scars on their faces. Obviously reconstructive surgery was done on them. Is it a money thing? Is it because of funds that they had those scars? Can reconstructive surgery be done in such a way that it's a finer finish rather than what I saw in those pictures? In other words, is money a factor there?
I won't necessarily say so. So for those who receive reconstructive surgery, they receive it free of charge in the Sokoto hospital where we support. And for some of them, they receive surgery. For some of them, they need more cosmesis after they've had the restoration of function because they're not able to chew well or they're not able to keep food in their mouth because of the hole. The reason why you see it in a different color is because of where the skin is harvested from. You know, they've lost that skin from their face or that tissue from their face, and the surgeons would have to get skin from somewhere else of the body. And you know, the skin of the face is a different color from other parts. Okay. So in that venture of getting something from another place of the body, they would have a different color or they would have some scars. But
let's quickly take this call.
We're able to ensure.
So, sorry to jump in there. Let's take this call from Emmanuel, calling in from Lagos. Hello,
yeah,
Emmanuel.
good morning.
Good morning. What's your question?
Good morning. Yeah, my name is Emmanuel. I'm coming from Lagos. Yeah, thank you for the study. This is Noma. I want to ask the doctor there whether the Noma can happen to an adult.
Oh, yes. She has already answered that.
Because I myself,
it can happen to adults.
I used to have sores in the mouth for a long time now. You know, it will come and go. I want to ask, what can I do over it? I don't know whether it is normal. I'm just hearing it now. I don't know. I've gone to hospitals. Sometimes they'll be telling me take vitamin C. But after everything, the sore used to come and go. So I need help, seriously, before it turns to another thing.
Thank you very much, yeah. Emmanuel. I'm quite sure it's not normal, but let the doctor speak about it. He's actually been to a hospital.
Yes. So we have what we call simple gingivitis, which is different from what Noma is. Noma is more an acute necrotizing gingivitis.
For simple gingivitis,
yeah, so necrotizing is more, like say, tissue death or tissue loss, as opposed to gingivitis. That's when you would, if you're able to see someone who has it, has this really fetid smell coming out from the mouth, as opposed to a simple gingivitis.
Okay, doctor. I'm afraid that's all we can take on the program, but thank you so much for educating us about Noma. See, so many people don't know about it, but it's good that we are bringing it to light now because it's happening in the north especially. and in the South too. Thank you so much for being on the program. We enjoyed your visit.
Thank you for having me.
And thank you, Emmanuel and Ada, for calling, and everyone else for letting us into your homes for this program. I am Mary Alale Yusuf. Bye-bye.